Welcome to the Recovery and Company podcast, featuring addiction and recovery experts with the latest recovery news, treatment options, therapeutic techniques, causes of addiction, and stories of hope and healing from those in recovery. Hey friends, Jody Stevens here. Recovery and Company is a production of the Life Change Center. We're in Northern Nevada. We have 3 locations and we provide treatment for heroin and prescription medication abuse. You can listen to this show on your favorite app or by clicking podcast at thelifechangecenter.org. Welcome back. This is part 3 of this 3-part series, Family Therapy and Addiction Recovery, with Dr. Deacon Shoenberger. Dr. Deacon Shoenberger is a licensed alcohol and drug counselor. He is a licensed psychologist. He's in Reno, Nevada with Health Psychology Associates online at hpareno.com. We covered a lot of stuff in parts 1 and part 2, so be sure and check those out. Last time we talked about what is a closed family system, how counseling can help. We talked about the impact of years of emotional invalidation in the addicted family system. We talked about risk factors in the addicted family system. We talked about the challenges of adolescent substance abuse and the developmental stages, that and tons more. So be sure and check out parts 1 and 2. Welcome back, Dr. Shoenberger. Sometimes I think it's okay to have to remove yourself from the family for a period of time. I know I did that, and it was just, and sadly it was during the time that my brother got the worst before he passed. So there's guilt in that, but then I was trying to stay sober and it was very triggering because of all the drama that was going on. And I removed myself from the drama. I wish I hadn't, but I don't think I was strong enough. I think sometimes we have to, would you say, maybe move out of the family system if there's some toxicity, and then when we're strong enough now, then maybe we move back in, right? I mean, have you seen that where that can be helpful?
Absolutely. I've been personally and professionally involved in relationships where, moving away and getting away from it was the absolute healthiest and right decision to make. So, family therapy doesn't always hold the assumption that everybody should stick into this, if everybody's coming at it with the idea that we want to get healthy together, that's awesome. Then you got a lot to work with. If you have 3 people who want to get healthy and solve it, and one person who says, I don't really give a crap what you guys want, I'm going to keep doing what I do. That's tough to work with, and it's a different goal that you're working. So that's, again, why it's interesting, is because every system is different. Everybody participates to a different degree. And, you do have to talk through even those dynamics and decisions, because guilt can show up, and you got to remember, I did this for a reason, given the context, given the circumstances. And I didn't do it just because I wanted to punish somebody. I was thoughtful and considerate and kind. And sometimes when you're kind and considerate, you tell somebody to take a hike.
Yeah, that's true. That's true. Well, and it's, the goal would be to get everyone to engage.
Yeah.
Like you said, it's not always possible. And a lot of times I've seen this in addicted families where it's just the way things are, or that's just the way your mother is. That's what my dad always said. And it's like, so you're kind of stuck. And then at the same time, it's like, well, he just needs to stop drinking, well, where do you go with that? Right. I mean,
well, that's what developed, also in the 70s, that whole, popular literature around codependency and all those behaviors that came up in families, especially with addictions. I mean, that's where that whole literature came out of. And, you can, like you just described, you can see the different layers of relationship that get distorted by substance use. And, let's say you're a kid who naturally wants your parents' approval and acceptance. You can see the different contortions that a kid would go through to excuse behaviors that are, not okay. But hey, I'm going to power through because that's my mom, that's my dad. And you develop some weird relationship habits in different relationships because of that. So it all layers out in these very interesting ways, and that's what makes it really important to be a piece of your recovery, is understanding where you came from, how you got to be who you are.
Without getting too technical, are there a couple types of family therapy that you would use most if you're kind of assessing a family, or there's, maybe a couple treatment methods that work the best when dealing with families with substance use disorder?
Sure, yeah, but I mean that's obviously personal preference, right? Like I said,
Mhm.
I have extensive training in behavioral therapy, so I
Mhm.
use behavioral family therapy, and especially behavioral parent training. I think is really really successful for parents of adolescents and kids.
Mhm.
But there's therapists that I really admire who are psychodynamically trained, and they approach it from an object relations framework where you talk through things that you might have heard of, secure attachment, insecure attachment.
Yeah.
That's a really, once you
Huge.
understand your attachment relationships, that's a very powerful way to understand yourself. Some of the marriage and family therapists that I work with who are really well trained in, structural family therapy, Minuchin type skills where you talk about the family as a unit and the behavior of each individual person impacting the relationships, or strategic family therapy where you talk about
Mhm.
family roles that are created by the different dynamics and the substance use. There's solution focused therapy where you're
Yeah.
more focused on the health of the person than their sickness, and what their resources are. But what I would say is what's going to work best is what the therapist is really well trained in and
Yeah.
understands and believes in. Because, if you threw me in a room and told me, I need you to do psychodynamic family therapy with this person,
Yeah.
I would know the terms and I would understand what I'm supposed to be trying to do, but I would not be able to do it the way that somebody that I know who knows what they're doing does it. But
Yeah.
if I'm coming at it from my perspective that I believe in, that I understand, that I can think through the variables like this, then it's going to go a lot better because, you know, a therapist's confidence matters too. I mean, if they think
Mhm.
they know what they're looking at, how they can affect change, that they can, line up with the family members and get everybody on board, then that's a great experience. There's a
Yeah.
lot of good techniques. It's just, the, it depends on who's applying it.
And there are so many tools, and I think you
Yeah.
can integrate kind of a lot of them too,
Yeah.
particularly like with trauma and you're talking about attachment. I think that's good. Somebody comes in, maybe they don't care about that. Like for me, I was one of those, like, I like the whole psychoeducation, like the more I know, the more I understand. Some people
Right.
don't care. They just want to fix
Right.
it. Like my husband's more like that. He just
Right.
wants to fix it. So probably just depends on the person, but you can
It does.
do, you know, helping people like the cognitive behavior where we're changing some of our thoughts and then
Right.
changing some of our behaviors and
Yeah.
then looking at our strengths. And
Right.
I don't, I think that like you said, it really just depends on the situation and the person. And you can probably kind of integrate a lot of these different types of
Absolutely.
therapeutic techniques. But I think the important thing that I always say in every segment is that there are tools, there are different ways of being.
You bet.
Like, if you're struggling and your family is struggling, it's kinda normal. I mean,
Right.
the world
Right.
is kinda crazy right now, and so,
Right.
like, it's okay, like, you could get help and learn completely. Like, I look back and I go, "I'm not even who I used to be." Like, I'm not
Right.
who I was, like the song, so you can really make a lot of changes with the right tools, right? And I would say there's no harm and shame in that.
Well, and to add to that, there's all different types of therapists, and we all
Yeah.
have our own properties that we're bringing to the party. And somebody might not feel comfortable talking with me at where five other people might really want to talk to me, and that's a piece of treatment too. Is you might just not like the person that you're seeing. Don't feel bad about it. Go find somebody else. There's a lot of therapists, and they approach it from different ways. And what resonates with you is what resonates with you. It doesn't have to come from one person. That's a thing that I've seen is people feel guilty about, oh, well, geez, I'd like to see another therapist. Well, go do it. You might like them better.
Yeah, that's a huge piece too, because if you come from trauma, sometimes, you look at the therapist, they're like this big authority. It can be very triggering. It can be very hard. I went through all of that.
You're right.
But somebody said something like, just think of getting a therapist is like getting any type of a product. And when you can kind of separate yourself, then it makes it a little easier. Like if it doesn't work, it's not just your fault. It doesn't make you bad. But that's a tough one. That can be very, very scary. But it's okay. Sometimes you have to try some different things, just like anything, to find out what works.
Well, and I totally agree. And on my side of the coin, I feel like that's part of our job as therapists too, is periodically check in. How's this going for you? Are you getting what you need out of this? Are we doing the right thing, or should we keep plowing ahead, or do we need to find other solutions? And so everybody has, just like we're talking in the system, everybody has their part to play. We should all be constantly sort of paying attention to, is this going in the direction we all want it to?
Yeah, absolutely. It's been super great to chat with you about addiction, family dynamics. Let's let people know how they can get in touch with you if they would like to.
Oh, sure. My business is called Health Psychology Associates. Our website is hpareno.com. I think I still have a Deacon Shoenberger, Dr. Shoenberger website out there somewhere. So pretty easy to find, pretty unique name, but there's not a lot of deacons running around. So
that's true. Awesome. Dr. Deacon Shoenberger, thank you so much for joining us.
It was great. Thanks a lot.
All right, friends, in Recovery Company, again, it's a production of the Life Change Center. We've got 3 locations in Northern Nevada providing treatment for heroin and prescription medication abuse. Please spread the message, share this show on social media, or with anyone you know who could benefit. You can leave a review on iTunes, whatever app you're listening through. We are on most of them. And you can also listen and click the donate button if you want. We always need your support. The Life Change Center is a nonprofit. You can listen to this podcast, check out our website. We're right there at thelifechangecenter.org. So thank you so much, friends, for listening, and we will talk to you next time.